correct. I'm a former surveyor for Health and Human Services, also known as DADS before they changed the name. So I surveyed from 2015 to 2017, and then I began consulting because I wanted to help the providers instead of being the person to cite the providers. And I saw an area of need that wasn't being fulfilled, so to speak. So I've been doing this now. This is 2021. I started in 2017. I've been doing this now for 4 years. This has been a great year. We've just licensed number 14. So we've had 14 different facilities get licensed last year. We've had about 100% conversion rate on our corrective action plans. So when the state is sending out our clients corrective action plans, we're completing those, helping implement the changes that need to be made, and then sending those back to the state, and those are working wonderfully. So just everything's coming together. It's been a great year. And if you would like to know more information about my business, you can go to www.roaconsulting.services. Again, that's www.roaconsulting.services. But today we're going to talk about the different changes in assisted living facilities that have come up since the latest iteration of the regulations, as well as we want to open the floor for questions so that I can assist, but also the seasoned providers can also assist with any questions that you may have. So if you come to the last couple of meetings where John has been here, or even the last time when Fred was here, we talked about the various changes that were going to happen in the facilities. But now that we have the regs, we can see very much more clearly what those are. Okay, so we're going to talk from a health perspective, and then we're also going to talk from the life safety perspective. Okay, so an assisted living facility has to go through two certifications when it opens. It has to go through life safety certification and then health certification. So you're going to have a life safety surveyor involved who is looking at the physical plan of your home, and then you're going to have a health surveyor involved who is looking at the policies and procedures, the resident care, staffing, and the running and the maintenance of the home from the perspective of care. Okay, so a couple of things that have changed from the life safety perspective. If you have a facility that has a gas burning furnace and it's in your attic, you're going to have that attic sprinkled at some point. By 2024 is the date. So that date is no later than August 31st, 2024. And I know specifically that you're going to have it sprinkled because I just had a client who they had done some construction to the facility before the regs came out. And so their construction company and the sprinkler system company were on regs because that's what they had. But when the new regulations, and so we had to fight for them now. Okay, so if you have, you will have to have that attic sprinkled no later than August 30th. There are some changes to surveyors use. So not only are there changes to our regs, which is the 553 of the Texas Administrative Code, the regs that the life safety surveyors use, such as the NFPA and then the boarding care facilities regulations, have also changed. So that means that we have to understand not only what we see from the Texas Administrative Code, but also from the perspective of the life safety survey. So in the Texas Administrative Code, it tells you exactly where you can find the regs that have changed. Okay, so I challenge you all to go in and to explore that for yourself. Right? We talked about in detail. We talked about in detail the different things that people are being cited for. And since we're talking about life safety right now, I want to focus on the tags that I've seen in the last 3 months. Many facilities are being tagged because they're not doing their smoke detector sensitivity tests. and that should be done biannually and initially when you're opening up your facility. I'm also seeing tags for individuals not monitoring simple things like fire extinguishers. And that card on the back that you have with those little lines, every time that you are, every month you should be monitoring that fire extinguisher to make sure it's still in the green and it still can be used properly. Okay. I've also seen facilities not in good repair. That's come across my desk a couple times. So even little things like paint chipping off the wall or scrapes on the wall or flooring that's not being mended properly are being tagged. And so it's very minute things that we overlook in a day to day because we're providing care that the life safety surveyor is going to come out and look for. Um, and we'll tag you. One of my clients had some tile broken in the floor. They received a tag on it, even though the construction worker was there getting ready to fix it. So life safety is really getting a little bit more hard nosed on ensuring the safety of the residents in the facility. Okay, all right. Now, since life safety is coming to your facilities and checking for things that we may consider minute, I suggest that you do a full overview of your facility top to bottom. You need to make sure that everything is in proper working order. You need to check your internal systems to ensure that there are no flammable items. That means HVAC, hot water systems, even up in the attic. You should not have any materials up there for storage. All of that should be clear because they are considered fire hazards. Okay. Um, if you are going to be doing any work to your sprinkler system, you want to make sure that the company that is doing the work is using the new regs so your system to meet whatever the new regs are for you, a 13, a 13B, a 13, or the type of residence you're in. That depends on the system you have. You want to make sure that your company is going to be able to meet the new requirements, okay, by 8/31/2024. So don't wait, do it now, okay, right? Um, there are some more detailed life safety things in terms of the way new facilities are constructed. So if you're opening up a new facility, this is the time for you to get into the regs because they reorganize the regs where it doesn't tell us for all facilities in one location. It's literally broken down by new small, new small A, new small B, existing A, existing B, and it's telling you the exact procedures and the policies that you need to follow to set up your facility. Okay, so that's for people who are opening up new facilities. Before I move on from the life safety perspective, does anyone have any questions?
I have a question. And there was some reference to the sprinkler in the attic. I know we've heard this before that it was coming. Well, we've also heard that they were gonna allow you to, if you wanted to enclose that unit in your attic, build a room around that unit, then you could just sprinkle that room. Is that a true statement or has that been approved, accepted? Do you know?
I don't know that that has been accepted. I don't know that they actually have a rule in place for that yet. The actual life safety survey that I was dealing with this was Ray Barker. And the only option that he gave us was that the attic needs to be sprinkled. Yes. But because we had already started the construction prior to the regs coming out, they're going to allow a variance for that particular case. But anybody going forward, if you're opening up a facility, you need to do it now because they're not going to wait. And there was no option for it. Yeah. I'm not saying that won't take place because we know the state, it can be something today and something different tomorrow, but that was not the option given. Yeah. Yeah. Okay. Any other questions about life safety?
No.
Okay. Okay. All right. So what you really want to do is to make sure that whoever is monitoring your alarm, whoever is maintaining your alarm and your sprinkler, they're up to date on what the regs are. So have those conversations with them, because if they don't know what's required, then that can set you back in terms of getting your facility renewed. Okay. Right. In terms of health, there has been several health changes, namely the health maintenance activities, infection control, and then also the advertising of your facility. So I'll start with the advertising of your facility. If you are putting any type of materials out for your facility in terms of advertising, promotions, solicitation, you have to put your facility ID on there. So if you haven't been doing that before, you need to start doing that now. Okay? It is a new. In terms of health maintenance activities are now a part of the regs, to where if there is a medical procedure that a client needs that can be not delegated to a staff person, but a staff person can handle, a RN must come into the facility, assess the resident, assess the staff to determine if they'll be able to do that activity without RN delegation. Okay. So let's say, for instance, and I'm going to pick on you, because you're nursing the room. Okay, so let's say, for instance, they have tools that much in the assisted living facility. It's a staff person who's capable of maybe flushing it or getting meds through it. You would come and assess that person, and then let the facility know whether or not the staff person can do that without an RN delegation. Okay, which means you don't need an RN in the building to ensure that those things get done. Okay, so if you do have residents in your facility who need to have that type of assistance on a day-to-day basis, and you don't have the space or the bandwidth to bring in an RN every day to do that, then you can go ahead and facilitate that for a client, which is a good thing, because it allows you to care for people in a way that you may not have been able to do before without calling home health or hospice or an external RN. Okay? The other thing that I want to really focus on is the infection control policies and the changes that have come to the infection control policies. So for one, you all have to have rapid flu testing in your facilities now. And what that means is you have to contract with the facility that will provide you rapid flu testing as soon as possible if anybody is suspected to have flu in the facility. Okay?
Only if there's someone there suspected to have flu?
So that's based upon what I gathered from the regs. That is what I found.
Okay.
So if you suspect someone to have flu in your facility, or even if somebody is diagnosed with flu and they come back in, you have to rapid test everybody in the facility. And you already have to have a contract with them in place prior to the rapid testing being needed, okay? A pharmacy can absolutely do it. So what you need to do is, I Googled rapid testing and I found pharmacies in my area that would do it and would provide it to me. And then there were a couple companies that would provide it as well that aren't necessarily pharmacies, but they are in the medical area. So you definitely need to do that, okay? One of the other things that was required was for us to be using biohazard bags, and you isolate. I'm still trying to figure this part out. What amount of waste does it need to be that level of I have to hire a waste management company? Because in the regs it says you need to research a waste management company that takes biohazard to come and pick that up, as to not infect anyone else and to not put it into the regular garbage collection system. Okay?
Normally, when it's smaller amounts, you put them into a biohazard receptacle as well, and then that determines when biohazard comes into it.
Okay. So
You can can get it online, any medical supply company. It's just the red canister that you step on that opens and the red bags.
So, Pat Nixon was saying that you can get the actual biohazard receptacle. And most medical supply companies do have it. You also can contract with a medical waste company to come and get your biohazard up. Okay, and literally you can Google biohazard companies here in the area, in the metroplex, and you can schedule appointments with them to come and pick up your biohazard.
Does anybody's facility do this already?
It depends on that. It depends on
Has
that.
anybody's facility do this already?
Nobody's
Really,
doing,
sounds like we all need it.
nobody's putting biohazard in separate bags. How are you getting rid of your, okay, but who picks it up?
City garbage.
Okay, so you're putting the garbage collection.
So previous, before COVID, it was double bag tied, and you could dispose of it. For sharps container, you could tape them closed. But since COVID, they've come down with a lot, it's gotten a lot stricter, of course.
So what we're talking about is the fact that your biohazard has to be collected by a medical waste company now. And it says it in the regs, and it says it in the infection control policy regulations, that if you have biohazard, then you should have someone coming to pick that up, especially if it has anything to do with infectious diseases like COVID-19, okay? So,
So even the small containers that you put in needles in, for instance, the small red containers?
so how are you disposing of those now?
They're not full, they're not even half full.
Okay, well, no, once they're full, yes,
With the needles and stuff, I went to the Lancaster Fire Department, I went to the pharmacist, I went to the police station, I went everywhere. They all told me pretty much they don't collect them, put them like in those, you know, you get those Tide pods, put them in there, tape them up, put them in the trash.
Yeah, you just take the close, because the sharps container itself is a biohazard container. So that does what the red bag does, it's just a hard container to stop the needle from puncturing. So as long as you take that closed, you're stopping it from escaping.
Then you can go in regular garbage.
Once you take it, well, that's prior to COVID. That's where.
that's prior to when the new regs came out, which was 8/31/2021. So in the new regs in the infection control section, it says that we're supposed to be disposing medical waste with a medical waste company. And so what I'll do is I'll I have the regs right here. I tabbed them and everything, so we can look through them in just 1 second. But if you are dealing with a lot of bio waste, then maybe you do need to call one of the medical waste companies and say, hey, can you pick up every 2 weeks? We have a container to leave the biohazard here, in a safe area where the client can get to it until that medical waste company comes and picks it up.
Biohazard or medical waste.
So sharps, soil products, materials, diapers, the bed covers that you use, anything that has been soiled or contaminated by that person, they can't be used anymore for the most part in their care. Okay, so I'm not saying throw out their beds, things like that, but you might have to throw the linen out if you can't clean it properly. Okay, and to me, if you're dealing with someone who has a high infectious disease, I wouldn't keep the linen anyway. I just throw it away and just replace it. Now that may not be the best idea for everyone, but for me, for hygienic purposes, thinking about taking that linen, putting it in a washing machine where other people's things are being washed, that would be a problem. So I would throw linen away after someone has been using it who has a high infectious disease. That's just I think that's best practices. Right.
Mainly would be for someone that's quarantined for 14 days, right?
Or any type of isolation, C. diff, E. coli, anything that you wouldn't feel comfortable with. It remains soil, taking it from one room, putting it into another resident's room. You shouldn't feel comfortable doing it, even though it's been washed, then it needs to be back, because even now, putting it wherever your trash is stored is the equivalent of putting it in a room where another resident is.
Absolutely.
This is good. Any other concerns? I'll ask you, Luke.
Oh, no, go ahead. So any other concerns? I definitely think you need to go back and revisit your infection control policy and go back and revisit the regs because we have to include rapid influenza testing. Then we also have to include getting rid of biomedical waste. We have to include the information on how our staff is going to be vaccinated if they're required to be vaccinated. So if you have required your staff to be vaccinated, your infection control policy needs to reflect that. So if you require them to have COVID-19, influenza, pneumococcal, whatever vaccination, it needs to be included in your infection control policy. Okay. Also, ensuring that your infection control policy covers what you will do in the instance that someone gets ill with COVID-19 or with the infectious agent. I've seen some policies where there's a little blurb about, okay, if a person gets sick, we'll isolate them in this, and this. But what steps are you gonna take to make sure that the facility is cleaned properly? Are you gonna put one-on-one staff with that resident? How are you gonna facilitate those type of things? So really go back and revisit your infection control policy because when the health surveyor comes out, they're gonna look at that to see if you're meeting the new regs. Okay? Right?
Actually, I have a question. Let's go back to delegation. When you have someone on insulin, that be a med delegation or not? Because I had that problem.
Yeah, I'm gonna let the nurse answer this because my answer may not be PC, but let her answer.
So medication delegation is very specific on the route. Subcutaneous is not a route. Can insulin be delegated? Yes, it's considered a high acuity field. The supervision requirements are different than what's required for oral, topical, nasal, things like that. But it can be delegated, absolutely.
So,
Or it depends on the survey.
Of course, that's always. And even assisted living just depends on the survey.
and I was just gonna say, it depends on the surveyor. So if you are gonna delegate insulin, make sure your training, your information, your follow-up is tight. Make sure you have everything reported as to who trained them, how they can access them, and knowing for sure that the person who's doing it is doing it right. Yeah, just to keep yourself out of trouble, because if a surveyor comes in and you're doing injections, they're already looking at you, you know? So be
There
very
are
careful
state
with that.
documents that you can put in place in your client's binders as well as in your policies that the surveyor cannot ignore.
Mhm. Absolutely, absolutely. And I would venture to say, put that in their service plan, and it needs to be recognized in the comprehensive health assessment.
Absolutely.
That meds are delegated.
Insulin delegation as
Insulin.
well.
Yeah, specifically injections. Yeah. So I would be very careful with that. And then I will also say this. Some of the tags and the citations I'm seeing on the health side have a lot to do with facilities not following their own policies and procedures. Okay. I know it's been very difficult to find consistent staff. That can also be a strain when trying to train because you're just trying to get people in the door and get them working. But I'm seeing a lot of tags that shouldn't exist. You know, you should know what your policy is when you answer the door in COVID. You should be checking temperatures and answering all 14 questions and not letting people just walk through the door. If you have a visitation policy in place, you should be following your visitation policy. Your residents don't have to wear masks if they're vaccinated. You don't have to make them, they can't be made to wear masks. Now, the visitors need to wear masks and whatever rules you set forth for them to come into the facility. And then you also need to be providing a separate area for them to meet. So all of these things are little bitty tags that I'm seeing, and I think it's just because people are worn out. And it's been a lot going on and it's a lot to manage. So monitor the little things that are going on in your facility to ensure that your staff are following the correct policy. I walked into a client's facility the other day. She had a new staff person. She greeted me and left. She didn't check my temperature. There were no COVID forms at the door. I said, I would have cited you out immediately. Immediately, I would have cited you. And then you answered the door with no mask on. So you're standing face to face with me. Okay, so let's focus on the little things that, you know, we may have let go in this time period of being stretched and stressed. Okay, um, please start using progress notes in your facilities. I don't see enough facilities actively using some form of progress notes. It can be a checklist with ADLs for each person. It can be anything that shows that you are monitoring these residents. But what I keep finding is tags where a resident was supposed to go to the doctor and they didn't go, and then they got a pressure ulcer and something else happened and nobody knew what was going on, because not only were they not taking progress notes, they weren't doing shower sheets and doing body reviews. So just little things that housekeeping and training and talking to your staff, talk to them till you blue in the face, put cookies in your pocket like Lynn O'Neill said, and you go and quiz them and walk down that hall or in that house and you ask them what they're supposed to be doing, because there's a lack of knowledge taking place with I guess staff turnover, and it's understandable because you're trying to get bodies in the door, but that's going to get you cited every time.
Or somebody hurt.
Or someone hurt,
Right.
or both. Okay. So paying attention to your documentation, being sure to keep up with your required yearly appointments. Make a checklist. On that checklist, it should have your smoke detector test, your gas heat inspection if you have a gas home or a home with gas appliances or internal systems in it. You should be making sure that your fire sprinkler and alarm is being monitored every 6 months. You should also be monitoring your resident books monthly. You need to know who's coming up on annual so you can get your comprehensive health assessments done on time, which I've seen tags for that. A lot of people are doing health that you need to be doing on a day-to-day basis with that particular resident, and that is not happening. And so it is leaving room for error, and people are being cited because residents are going through issues that they shouldn't be going through because nobody is paying attention on what's supposed to be happening. Okay, so institute progress notes, institute shower sheets. Make sure that you are reviewing those resident charts at least once a month, including your medication administration records. So I kid you not, I walked into a facility and this person has been in business 15 years. She hasn't been doing Mars for 7 of them. Because some surveyor came in and told her, as long as they're taking it and nobody's missing a day, you don't have to do some Mars.
Well, Morris is not required for that.
If you administer medication.
Morris?
A medication administration record where you're writing down that they're taking meds every day. Yes.
I didn't sit
But
there.
Morris is not required.
But the key is if you're administering,
If you're
if you're assisting,
administering,
that's
I'm
different.
talking about administering.
No,
If
I'm
she
talking
was,
about Morris forms.
no, we're talking about the medication administration record where you check off the meds on the list. Yes.
Yeah, because most situations, we're just assisting
Yeah,
and not administering.
but in this particular facility, she was
She was
administering.
administering,
Yeah, and some people are saying that they're assisting,
but they really.
but they're really administering, okay? And you open yourself up for failure, because a good surveyor is gonna come in and look at your records and say, oh, okay, I'm gonna go talk to the residents. Who gives you your medicine? Oh, the caregiver A gives me my medicine. I said, oh, okay, so do you know what medicines you take? No. Okay, I just caught you saying that you're supervising when you're really administering, and that happens. It happened. I did a mock survey on a facility, and one of the staff did that in front of my face, and I said, this right here will leave you open for IT all day long, because not only are we talking about one resident, we're talking about all of the residents that you administer to. Okay. Okay. So please be careful with the things that you are saying you were doing. Okay? And if you're going to be staff, even if you're just doing it by color, you're yourself up for more citation and violation. And I have seen that tag come across my desk, I think 2 or 3 times this year.
And if the service plan matches that.
And I was just about to say, when you are getting ready to put together your documents for residents, everything needs to match. So whatever you found out in your health assessment about their dietary needs to match what you put in their service plan. Needs to match what you're doing in their progress notes every day. Okay? Needs to match what you trained your staff to do. Okay? So everything requires time. Okay? Because a good survey is gonna catch you.
Medications. As opposed to putting it in their hand, put it in their mouth, put it in their hand. Is that assisting or is that administering?
That's assisting, but here's where I found the biggest contradiction. When our health assessment or our service plan says that they can't follow simple commands, and we're documenting that we're in their body. That's if they're putting it in their body themselves, then they're assisting. But if you're feeding them, there's no way you're assisting them with medication.
And if you're saying that you're assisting them, they need to be able to recognize those meanings themselves without you prompting them. Okay? Or even if it's just, hey, what is this? It's yellow, it has a line through it, it has these numbers on it. Oh, that's my medicine for my blood pressure. Even if they don't know the name, as long as they understand what it is associated with. Okay? All right.
But actually, what if they don't know what they're associated with, but they know they take 2 peoples of blue and a yellow?
I would say you need to work on teaching them what those meds are. Even if you have to do like a little skill sheet and you take a copy of the pills on a copier and you say this is Respidol or Respidol, this is Tramadol, this is Gabapentin, whatever it may be, and even give it to them. And they can say, well, I got my hand this right here, so if I forget, I know what it is. See, that's still them understanding what they're taking, right?
But wouldn't that still be part of the assisting, is because they don't know what the meds are, and we're assisting them by making sure they get the blood pressure, the cholesterol. We're not putting it in their mouth. It seems like whether they know or not, we still just assist.
I'm gonna let Pat give you the RN answer, and I'm gonna give you the survey answer.
And I know about the part. But I mean, at some point, so you can have surveyors that can just be a pain in the butt. You could have been one of those surveys.
So it's very subjective, right? And so what ends up happening is, what we do is we put what are called pill planner guides in place, because even if that person, let's say that person does have impaired memory, but they're able to take their medications, if it weren't for their arthritis, they would be taking them at home by themselves, okay? You're assisting. Maybe they can't name their medications off, and maybe you can show that this is something that you've been training on. However, the caregiver that's taking those medications from the pill planner should be able to identify the same things that she's saying. And so pill planner guides, and anytime you're taking them from pill planners, or if you're only assisting with medications, then you should have a pill planner guide with the color, a picture of what the medication looks like, side effects, and what it does.
They have some pharmacies that give you tomorrow with all that on it.
Yep. You should keep them in a binder, and those caregivers should be able to express, and this is where they look. And, the surveyor comes in and says, hey, well, what are you giving this for? Let me go look. That's the equivalent of them knowing. They don't have to memorize it. The resident doesn't have to memorize it. They need to know how to find out. Lucretia, what's that you give me in the morning, the red one? They know how to find out.
Okay? So as long as they have some type of recognition, you are assisting them. I'm gonna say, if you're touching their pills, you're touching their pills, and they're not touching their pills, or a hospice home health nurse hadn't put it in the mail binder, then if you're touching their pills and giving it to them, you're administrating. Because that's what I was taught as a surveyor. Okay? If a hospice nurse or a home health nurse is doing it and putting in the pill binder, okay, as long as they can recognize what's in that pill binder, we're good. You're doing supervision or assistance. But if you're touching their pills, you're doing administration.
So he's filling the med minder.
If you're filling the med minders, you're doing administration, especially if you are not RN. touching their pills,
Give
okay?
us some pushback. I ain't touching you.
Hey, as long as you're, okay, Miss Smith,
Right, with bubble pack.
which one is this, Miss Smith? Oh, that's my high blood pressure medicine, okay. I'm not physically putting my hands on, as long as I'm not physically putting my hands in pill jars and touching pills and manipulating pills.
So then that changed the whole definition.
I'm saying you're administrator.
Now, is that an opinion or is that the?
That's a
Those are opinions that I bring tags on.
You one of them hard. You one of them.
So-
So the Board of Nursing describes medication administration as removing the pill from a properly labeled container and placing it in place to be taken into the body. Okay, and so what Ashley is hinting to is if you're removing pills from a bottle or from the blister pack, if you're doing administration. And so we talked about the pill planner. You cannot supervise medications if you're pulling them from individual bottles. That requires training. Does that make sense?
So what about if you pull them from the plant?
From the planner, you can supervise, and that's when you should have
Because you
a.
can take the plant and just dump the pills in there?
Right, so you don't have to, when you're just coming from the planner, you're not having to read bottles and
Okay.
say 1 tablet, 5 mouths every
So
4 hours.
medication aid to fill the plant.
A certified medication aid
And
can
then
fill the planner
do medication aides still need to have a registered nurse?
to supervise them.
Exactly. So if you have a CMA, you still need to have an
So it's
RN.
better to not have a CMA.
Oh, yeah, absolutely, they are, yeah,
It's better.
they contradict everything clinical.
Okay. So I did want to make sure we talked about TB, because a lot of people have been asking about TB tests. People are not making them available anymore as they have been before. I've had a couple facilities that have had a hard time getting TB, actual TB tests. So what the state is requiring is that you do a screening. Okay, you do a screening within your facility for TB. You ask, so it's a questionnaire that you ask, and you literally can find one online and pull it off. Okay, so do your screening with your staff when you're hiring them. Do your screening with your residents. And just make sure you're keeping up with those things, okay? And ask them all the necessary questions. Have you ever been diagnosed with TB? You have these symptoms. Well, I think they changed it because literally people are having a difficulty with getting TB tests. Yes.
If they refuse to do it. TB test.
The screening?
Yes.
The screening is just questions.
I mean, the test.
If they refuse to, you can make note of it and, yeah, and then let them know that they have to give you a chest X-ray. Yeah, they have to provide some type of evidence that they